Hi, my name is Bill Stanton. I'm an orthopedic surgeon here in Fort Pierce, Florida, and I'm Carol's younger brother. She asked me to chat with you in reference to the St. Vincent de Paul retreat that she's uh, conducting. And I wanted to tell her and tell all of you thank you, and I appreciate the opportunity to address you. Carol gave me a few questions that she wanted me to answer for you. And I'll go ahead and get started with that. First of all, though, I want to give you a little background. I'm an orthopedic surgeon, as I mentioned. I am previously an orthopedic surgeon in the United States Army active duty. Then got out of the Army, active duty Army, and joined the reserves, and that was in 2005. Since then, I've been deployed several times, both to Iraq and Afghanistan, and have a little bit of firsthand knowledge with field hospitals, and I think that's why Carol wanted me to talk to you guys. So the first question, describe the field hospitals you have been in. During my deployments, I've been in several hospitals, one of which was a very small, very mobile, something called a forward surgical team. Basically consisted of 3 tents, a operating room, a emergency room, and a recovery room / ICU. Basically 3 tents that could be placed and all the equipment could be placed in the back of 5 trucks. And move anywhere relatively quickly, set up usually within about an hour to 2 hours and be functional. Other types of field hospitals have ranged from a strictly group of tents that were interconnected and basically in a complex that would greatly enhance the amount of care that could be delivered over what I just described. Basically a ability to treat many more patients at one time, to treat more severe illnesses and injuries, to hold on to people also. The small 310 hospital was not meant to ever hold anybody, just meant to treat life-threatening illnesses and then disposition them to a higher level of care. I've also been in a hospital while in Kosovo that was basically a very modern facility built from the ground up, hard facility with CAT scans and roofs and floors, etc., and all the modern conveniences. This was a hospital that would be meant to be given over to the locals upon our departure. Much like as mentioned, a small community hospital would be here in the United States. And then there was also a time when I was in a field hospital that was basically a hard building that had been used for something else, that had been converted into a medical facility, and there are also some tents that have been added in order to improve the capability. So these are basically the field hospitals that I've been exposed to during my deployments. Second question, in general, what is the role of the field hospital during combat? Field hospitals are usually somewhat mobile facilities that are situated near battlefields with the capacity to treat life-threatening injuries and illnesses. And then these are patients that are not going to be able to make it to a higher level of care, which takes longer to get to, basically. These field hospitals are designed to receive emergent and urgent patients and rapidly triage them, stabilize them, and treat their life-threatening illnesses in order to be able to get them ready to be shipped to a higher level of care. Next, Carol asked me to describe the best experience that I had during the time when I served in a field hospital, and to me that's not hard to come up with. I was arriving in Iraq in 2007 during the surge, was going to be working at a combat surgical hospital, which is one of the bigger facilities. And arrived right off the helicopter, was brought to the hospital, right into the operating room actually, where I found the orthopedic surgeon I was to replace hard at work, and it had been so for the previous 10 to 12 hours. So I went ahead and dropped my bags, got in my scrubs, and went in and assisted him with the case that he was currently working on, and then basically kicked him out of the OR and took over myself. This is during a mass casualty where I probably worked for another 10 or 12 hours on 6 or 7 patients. And they were mainly U.S. soldiers that were working on that day from a large explosion outside our facility. So I felt like I had immediately made a positive impact. We didn't lose any patients. I felt like I was there and doing good work, helping our troops out. And at the end of the day, I was very tired, but I felt like I really had accomplished something, and I was glad that I was And of course, Carol then goes on to ask, what's the worst experience I ever had during my time in field hospitals? And that's also pretty easy. It was the same deployment, and it was very close to the time when I was supposed to be leaving. Right there, during the last few days, we had another mass cow where we had 6 patients from a IED explosion on 2 vehicles. I basically was taking care of one of the very badly injured patients, had been wearing armor and a helmet that did help save his vital organs in his chest and his abdomen, but he basically had traumatic amputations of all 4 extremities and a head injury. We worked and worked for what it felt to be hours, which was probably more like about 45 minutes an hour, trying to save this soldier. And unfortunately, we failed. The gentleman passed away after, as mentioned, probably about an hour. At that point, I felt relieved, actually, that he had passed away because of the grievous nature of his injuries. And it didn't take me long to be ashamed of that I had felt as if I had failed this patient twice. First of all, I was not able to save him or do the work that was needed in order to stop him from bleeding from his grievous injuries. And then second of all, for having that little lapse, being actually happy that this person had passed away. And again, I was very guilty and shamed by that. And that was easily my worst day during work in a field hospital. Recently, the Pope described the church as a field hospital, and Carol asks, is that a good image for the church? Well, I've never really thought of the church as a field hospital in any context, but, you know, who am I to question the Pope? When I looked into his quote, I think the Pope was making an analogy between the church's need to address its members' more urgent needs, much like a field hospital would triage its patients and treat the people who had the life-threatening illnesses and injuries. And I agree that a church should concentrate on bringing us the true central messages of salvation, of forgiveness, and of caring for our fellow man. Most of us, including myself, need to reconnect with these central concepts before moving on to the finer points, smaller details of our faith. So I think that's what the Pope was getting at. Next, how is the St. Vincent de Paul mission like the mission of an orthopedic surgeon in a field hospital? Basically, I think St. Vincent de Paul cares for the needy in the community. The group also does its best to manage scarce resources and efforts to care for those who need help the most. It's also my understanding that once a person receives help, there are limits on what they can get and how often they can get it in a certain time period. The assistance given to the needy probably keeps them in their homes or maybe keeps them in their car, allows them to provide for their families, provide for themselves. Basically keeps these folks participating in society instead of being strictly a liability to it. And I'm sure that those who receive assistance are very grateful for it. And my job as an orthopedic surgeon in a field hospital would be to render specialized orthopedic care to those who need it, as far as being able to do so within the limits of time, equipment available, and the needs of others. And this care will for some allow them to return to normal life, return to the fight, and accomplish the mission. The patients who are capable are very quick to thank you for their help. For the assistance that I give them. And I think in these ways, the mission of the St. Vincent de Paul and an orthopedic surgeon in a field hospital are somewhat similar. And now Carol's given me the opportunity to give you some parting thoughts for the group. I've always had a lot of respect for those who can take on the smell of the sheep, those who work for the good of the poor, and such as St. Vincent de Paul, and do so on a regular basis. And I'd like to thank you for all your efforts on behalf of the poor in your local community and tell you to keep up the good work. And also to thank you for letting me discuss these topics with you, and thank my sister for allowing me to participate. And as I said, keep up the good work, and thank you very much.